Thank you, Clyde and the California School Employees Association, for your enormous leadership and support of single payer, not only with SB 810, but its earlier incarnation, SB 840, and of course, Donna and the California Nurses Association and all of the nurses across the country who have been really at the forefront of this. And I will overlook someone, of course, but let me try to also include in my thanks the California Teachers Association, the California Federation of Teachers. We have, of course, our umbrella organization, Healthcare for All, a project, and then, of course, underneath it, it's a project of One Care Now. Don Belcher, thank you for all of your great work. Yeah, let's hear it for Don. We have school districts and special districts, water districts in support, because they realize they will save money on their obligation to their own current employees and their retired employees' health care costs. So there is real reason for this coalition to continue to grow and to grow and to grow. And of course, this conversation would be immediately preempted if that Kucinich amendment is not strongly in place. So that's why the stakes are so very high, and I want to personally thank the congressman for his efforts, as I thanked Congressman Conyers earlier today at the rally for his leadership in keeping the single-payer conversation alive here in Washington. As was mentioned by Clyde, I have been the lucky beneficiary of the great work that my predecessor, State Senator Sheila Kuehl from Santa Monica, has done over the past 6 years on this issue of single-payer health care reform in California. Sheila is passionate and brilliant and funny and so committed, and really raised the consciousness of so many Californians, and that's what I think we're all doing here. This is really an educational campaign on this 44th anniversary of Medicare. It should not be overlooked that we're not jumping from a privately provided, privately funded to single payer. We have great history and great success with our publicly funded, privately provided health care. And so we want to celebrate that 44th, bless you. We want to celebrate that 44th anniversary of its creation and recognize that it has helped keep health care costs down much more significantly than privately provided health insurance. And it's also lowered the poverty rate of those over 65. That is not an insignificant fact, because so many seniors prior to 1965 lost everything as they got older and their health care costs obviously and naturally increased. They fell into poverty and, of course, often into bankruptcy and died indigent. Not a very dignified way to leave this planet, but our system was forcing that upon our seniors. And a lot of the same forces that are fighting us in this building today were fighting us 44 years ago as well. The growing number of Democrats who have signed on to our bill as co-authors is now at the number of 46 out of a total of, 46 out of a total of 76 Democrats in both houses. So that's 2/3 of all Democrats are signed on as co-authors. So we will easily get this to the governor's desk again. Now, we're not as fortunate as Pennsylvania, as our governor has no intention of signing this bill. He will be out at the end of 2010. We'll say goodbye, Arnold Schwarzenegger. We'll say goodbye, Arnold Schwarzenegger. And we will look forward to electing a Democratic governor in 2010, but we have to make sure that Democratic governors support single payer, and that's not where our candidates are right now. So that's work we have to do in California. And so this is how things will unfold in California. We'll get it to Governor Schwarzenegger's desk for a third time. He will afford him the opportunity to veto it yet again. But even when we elect a Democratic governor in 2010 who could sign our bill in 2011, because of our initiative and referendum process, we know the industry will spend the money to gather the signatures to try and overturn that which the new governor in the legislature has created. And that will mean a ballot battle in 2012. We also have to proactively put the finance piece on the ballot for the voters to approve also. So we have to go to the ballot nonetheless. and there'll be twin ballot measures. And so I figure our task is from this day until that likely ballot date in 2012, better educate Californians or whichever community you may represent to better understand what single payer is and is not, so that they'll be able to withstand, in our state, a barrage of misinformation. And how much will this industry spend? $100 million? $300 million? $500 million? Whatever it costs to hold on to the status quo, which is working only for them. And so that's our challenge. But we're very blessed with a lot of activists. We have hundreds of organizations throughout California. We've had a great supporter in Lily Tomlin over the past few years. And so Lily Tomlin, along with Elliot Gould, put together a gathering at which Sheila Kuehl and I spoke very recently. She has revived her character Ernestine. We all remember Ernestine, who used to work for the very evil phone company, right? Well, guess who she works for now? She works for the health insurance industry, and she's done, and we're going to have 365, one for every day of the year, 30-second spots. And different members of the Screen Actor Guild have already volunteered to sign up and do their spots. We're going to put them all up online. You can go to OneCare now, and you'll find them all. The number is growing regularly. And then we're going to ask everyone and anyone to make their own 30-second spot and have a competition. And everyone can give their story or their take on single payer, and we'll have a competition. We'll put them all up online, and anyone can go online and vote and decide which is the most popular. And we'll take the most popular homemade videos, and we'll use those in our paid media campaign, which means full-page newspaper advertisements and television and radio commercials. And so this way we want to get more and more people engaged. So this is the script, and I won't even pretend that I can do Ernestine, but I'm sure you'll follow along quite well. So we credit all of this to Lily Tomlin, and she, in her brilliance and in her humor, pierces so succinctly what this is all about. So she's at her desk with her hair, and you got it all, and her piece. She says, Controlled Healthcare Insurance Corp, Claims Department, Ernestine Tomlin. Nope, not covered. We consider that an elective procedure, meaning we elect not to pay for it. Then she snorts. I'll save you the snort. It's not our fault you've had 2 heart attacks. You should have stopped at 1. Of course you have a choice of doctor. Do you want the doctor we give you or not? It's your choice. And then she hangs up. So that's her first spot. And then the second one is Controlled Healthcare Insurance Corp, Claims Department, Ernestine. Nope, not covered. Being blind is a pre-existing condition. You should have read the fine print. We don't care if you're fed up, just that you're paid up. It's big bucks to run an insurance company. Medical care is the least of it. This kind of waste doesn't come cheap. At Controlled Healthcare, life itself is a pre-existing condition. Our prescription for it, don't get sick. You must think HMO stands for Help Me Out. Remember, your health is our business, not our concern.